Hey everyone, it's Dr. Russell, and this week I wanted to spend some time talking about chronic pelvic pain in women. Now, this affects 1 in 5 women roughly, so about 20% of women will have chronic pelvic pain at some point in their lifetime, and it can present in different ways. So, chronic pelvic pain could be constant, it can come and go, it can only occur during certain situations, so sometimes pain with intercourse or bowel movements or urinating, maybe sitting or standing might affect and cause the pelvic pain. It really can vary quite a bit. It also can change in intensity. So some types of chronic pelvic pain can be extremely painful versus others might just be annoying and, there every so often. And even the quality can be different. So for some women, it might be a sharp stabbing pain. For others, it might just be an achy kind of pain, a dull pain. It really can present in many different ways, but it's pain anywhere from the belly button essentially down into the pelvic area. And there's different conditions that can cause this pain in women. So really getting to that root cause or what's causing the pain can be important. And the reason I wanted to talk about this is I've had several patients who I think because of the way maybe society has talked about things like this for women, dismiss their symptoms, or it's not something that their doctor even wants to talk to them about, and they find it really discouraging because it is a chronic pain condition and can be very difficult to live with sometimes, but they're not really getting the resources they need. So I just want to at least kind of end that stigma that you don't have to be in pain. Again, 1 in 5 women this happens to, but there are options out there for you that are available. It's really just getting to that underlying reason of why it's happening. But if your doctor doesn't want to listen to you or kind of dismisses your pelvic pain, please go see another doctor. Pain should not be put up with. You really have options for that. So some common conditions that can cause pelvic pain and that can change the way it presents can be anything from endometriosis. You can also have fibroids or adenomyosis, where the uterine tissue is growing into the muscle of the uterus. Fibroids are just growths that are thought to mostly be non-cancerous, but they can cause definitely pelvic pain and pressure. We can also have, still in that area, cysts that even could rupture. Less common for chronic pelvic pain, but still could cause pain, would be an ectopic pregnancy. That can be very painful. And then in that area, we have obviously the bladder is around there. So we can have something called interstitial cystitis, that is kind of bladder irritation that can cause pelvic pain as well. And then just general muscle dysfunction. So we could have something like fibromyalgia or pelvic floor muscle dysfunctions. Maybe some of those muscles around there are really tight when they shouldn't be, and that can be causing pain issues. So again, many reasons, and that's not a complete list, but just some ideas of what could cause pelvic pain. But if that is happening, you really want to see at least a gynecologist or someone that can, do an exam or ask you some more questions to figure out what's going on. But some options for a lot of these are to reduce inflammation. That's going to help pain in general. And then honestly, the number one referral I make for a lot of chronic pelvic pain conditions when it's not urgent is for pelvic floor physical therapy. And part of the reason I want to do this video is because I think more women need to know about pelvic floor physical therapy. It's a physical therapist that works specifically with the pelvic floor. So any kind of conditions in that area, pain with intercourse, with bowel movements, urination. I've even had them help with women that have issues with having a bowel movement, especially it seems like post-childbirth, things can get a little lax in that area, but they can really help work through those things so that pain is either less or non-existent and goes away. So I'd really encourage you, if you're having any pelvic pain, know that A, you're not alone. A lot of women go through this. And B, there are options. And specifically, you might consider looking to pelvic floor physical therapy. And there's several here in Frederick that are wonderful. But if you're in other places, there's other options. But no, you don't have to suffer with this alone. So hopefully that was helpful. Please, if you have any questions, let me know. And I will see you next week for another video.